morning, Madam Jane. This is a quick video um, as a follow up to my email. Uh, Basically, just to be able to show some of the things that we talked about in the email. So, the some of these things you have already seen. We went through all of this before. But just to add few things, for example, when you logged in as a user, in this case I'm logged in as a finance manager. Um, if you click on the user and then you scroll down to where it says app information, you should be able to see the current version of the software. So if you see 1.1.0, that is the most current version. So you would have been in the, if you don't see this one, you can simply just click on check updates, and then it will tell you if you are on the current version, most current version or not. If you otherwise, you can install the most current version, or sometimes it will just simply ask you, it will have a pop-up that asks you to update. So, but moving forward, some of the things that we'll quickly look at is the inventory management, as we have added some things there. For example, if you come on the catalog, this user does not have you can see that they already have the different service or products under the catalog. Now, because they don't have access to the template, so I'm just going to log in as a different user, in this case an org admin that has access to that catalog. So if I sign in for that user, then because this is an admin account, we do require that it does have a two-factor, which is very easy to set up. So in this case, I'm just going to put in my second factor. So once that is put in, then it will log me into that account. So once you are logged in, then if we go to the inventory management for this particular account, we should be able to see that we have the template here. So the template is here. When you first log in, you will not have anything here, but you can come to this import from template, and then you can choose various templates that we have. We have a lot of different templates because we support a lot of different things here. Some of them are not relevant to you. Only you can select the ones that are relevant to you. For example, pharmacy, maybe not, but hospital and healthcare, 20 categories, you can click on those. You can also look at clinical and hospital services. You can also look at, I think those will be the ones that will be more relevant to you at this moment. Yeah, so it will be hospital, clinical and hospital services, and then also the pharmacy might be relevant. So it's a matter of just simply clicking on what you want. So if we click on this one, because I've already imported all of this, you can see it tells me that the SKU already exists. But if I don't have these things, so I can select all of them and then I will import. Since I already have them, it will just not import them again. So it has default pricing, so you can obviously go ahead and change this. So it again, it also has default durations. You can definitely change all of these things, and it tells you what the categories are and all of that stuff. And you can also see similar thing with the pharmacy, for example. Again, I've already have all of this. So again, these are just for default values, but you can always go ahead and change all of these things. Then I think the last one that may be relevant to you is the hospital one. Again, similar thing here. I have went ahead and imported all of this in my instance, but yours may be blank, so you might just still need to select here and then just click on import for you to import all of them. So once they are imported, they're here, so you can then view them. So if you click on this, it will just open this thing here, and here you can see the description, you can see the internal cost, and you can also see the billing rate. So you can change this, but if you go to edit, you can change the skill we have here is that, but if that's not something that you use, then you can always change it. These are all scene defaults. You can also see imaging, like the tags. You can also change here it does say clinical and hospital services. You can change the subtype if you want to go with maybe diagnostics imaging, for example, because this is an ultrasound. You can do that. You can change that, and then you can select whether this is outpatient or inpatient or emergency or a day case, and then you can put in the ICD codes, and different things that you want to set up for your service. You have a lot of latitude. You have a lot of options to be able to set this. And then again, for the billing, you can set it whether this is a study, procedure, or whatever it is, a session or whatever. And then you can set the internal cost and then your billing rate, how much it costs you internally and how much you are charging the customers. It's totally up to you. So but yeah, then once you're done with that, you can just update it, and now that will be part of your inventory of services and products. So one of the things you've asked for, the rest of the stuff I think we went through. The only thing I wanted to touch on is the bundles. You've asked us about the bundle, how to, whether we can bundle the different services. Yes, that is also possible here. So you can create a bundle. So if you go to create a bundle, you can name it whatever you want to name it, and then you can this can be a package, a kit, a promotion, or a subscription. It's up to you what you trying to do. So you can go ahead and look up the values here, the services. These are the ones that we just imported, the ones that I show you earlier. So you can just pick whatever you want here. So sometimes this list might be long, so you might just wanna, let's say you want to deal with dental package, you can just start typing dent, and and then it will only minimize it to those. So then you can start selecting your individual services that are going to be part of your bundle. So for example, we can say dental examination, dental filling, we'll add a dental scaling and polishing, as well as a dental tooth extraction as the part of the package. Then you can name your package whatever name you want to do it, and call it. And then the total in this case is going to be whatever primary you have set for each one, but then you can decide to override the price. So let's say instead of 9,360, you can simply say, okay, maybe this is 8,000 now. So if you do that, that will have been like a 1,360 off. So from the customer, what would the customer would have paid? And you can either set this to active or inactive, and you can check to show this in the POS, that is the register where the cashier, with the cashier where people will pay, so that it will be shown there as well. So in this case, we have created one, so we can just view that. Again, it's right here. If you edit it, here we said, okay, the price is 8,400, but it's a 9,000 360. So you have the latitude to choose, what packages you want to create based on the services that you create. So one more thing I wanted to mention, even though we have import some templates, you don't have to. You can always create your own individual item. So you can click on add item, and here you can put your item name. You can put your SKU, and then the different categories you can pick up from here. Or you can add a new category if you don't like the ones that you have. You can put your description. You can basically customize this thing to what you want. So you can create it whatever you want. So that's kind of like the major changes when it came to bundling and then the items to import. Now moving to the payment portal. In the payment portal here, so you will see that also we have that register that I showed you last time. Under the register, if you go in and as the customer, I mean there's the person who is going to be ringing your register. So they have different options here to pick from, like for example chemotherapy stuff. This is they can also do consultations. Basically they can choose from a lot of different things. Yeah, these are the things that we saw in the services section in the catalog. So they are here so that you can easily add them to the register, like just simply clicking on them. They will just show up on your register. So now you can see they are here, and then they are also, you can easily clear them from your register as well. As far as the bundles are concerned, those are here, so that will be around here. So if you click on the bundle, then it will show you your bundles that you have created, and you can see it says 960 savings for and it has 4 items. So you can simply click on it, and then it will add all of that here, and then with your override price here. So now you can simply then once your register, your cashier, can then ask for the money, or if it is going to be insurance or whatever. So in this case, it can be cash payment, mobile payment. Again, mobile, we have different versions here. We have the Wave, free money, Orange Money, M-Pesa, and MTM. These things do not by default work. You have to have the API keys. This will be something that organizations will need to set up with Wave, or whichever organization they want. Whichever company they want. We are working on trying to have a generic one where it will be available for everybody. But we will, work with the that will be a certain percentage of fees that will be charged for that. But this one here is completely free based on what your own setting is. And this is set in the organization setting, which I can show you later. I think I showed you last time. Then the other thing is you can also do a split between, let's say you want cash, and then you also want insurance too. So you can have, let's say they pay 5,000, and then the rest of it can be, the rest 3,000 can be sent to insurance. So you can do that as well. You can also just completely send it to insurance. So here you can select, either a new customer, patient, or a new patient, or whoever. If you want to create a new patient, you can add them here. Or if you already have an existing patient, you can, also do. Or if you don't need to enter the patient name, you can do it here. You can click that here too. So that package again that exists. So that is that. So I know the last time you did mention that you guys already have your own EMR. We have been working. I didn't mention this one because it's a work in progress. It's still not completed, but it's something that we have been working on, which is the our own EMR that is integrated. We don't only have EMR. We have pharmacy stuff, EMR, but also not only that, but we have a lot of different vertical services that are already also on the platform. However, we don't, they are not on by default. It's only enabled per customer or per need. So in this case, I'll show you an example of two of them that are enabled, which is our uh, healthcare EMR stuff and then the pharmacy one. But again, there are many other vertical services, because the rest of MTEMS is horizontal. Individual services horizontally, they are not interconnected. But the vertical services, create a different layer. So, and healthcare, for example, is one of those vertical services. If you click on healthcare, it will bring you the EMR dashboard here, and you can see from here we have 5 active patients, any appointments that are coming today, and queues and stuff like that. So, and then you can be able to see any revenue or recent payments that came through that. You also have the module directory, that is the individual things that are on the side here, and then any pending bills or raw stock, again. So you can look at the patients here. For example, this is the patients. You can add a register a new patient. You can click on a patient and then look at their chart. So for example, this is the chart for the patient, where you can look at the overview. You can look at their blood pressure, their heart rate, temperature, the system, the oxygen and the weight. The system will automatically create a BMI based on those information. So you can also see recent activities for what the doctors might have ordered. You can also look at the encounters. You can look at the um, uh, like the vital signs, medications, MAR, that is the medication administration record. So your nurses can also work from this. So for example, if they needed to give medication 8 o'clock, if they can click on that and will say whether they have given the medication or it's missed or the patient refused it. If they had to do any vitals, for example, blood pressure, in reference to this one, just to mention it, yeah, they can also do that. Any diet orders are also, you can add new diet orders here as well with some regular stuff here. You can also do labs. Again, you can look at the labs here, or you can order new labs as well. Like CBC, and then basically the category of the lab, any routine, whether it's routines on Genostat, and any clinical notes, stuff like that. You can also look at the problems like the diagnosis. You can add them here as well. You can do, look at the billing that is related to them. So, say this one here, for example, you can see again similar stuff here. They have encounters, which you can also look at. For example, if you click on expand the encounter here, this would have come from the doctors, and the patient visiting with the doctor, and this is the encounter, that happened. So example here, we can see that this is a dental work here. So and then the notes using soap, formatting, right? So it also um, um, they have labs here, for example. They have again, any prescriptions that they have done, they have prescribed, and then any vitals that were taken. Again, you can see this thing in the proper readings section, vital section. For example, here we can see that this is blood pressure, and then this you can see the arrows here as pointing that it started high but then they are low. That's because somebody made a mistake in this case and say 1125. That patient would not have been alive, but anyway, that's an error you can see. But also you can see the oxygen saturation, which also is starting at low and then it went higher. That's because if we look at it from 98% to 99%, it went higher. So similar things here. And again, you can add some more of those vitals here as well. And again, the same thing with medications. You can see these are their active medications. You can add new prescriptions again here. Again, MAR, we have, let's say, amoxicillin. That same thing I was showing. Similar thing here for paracetamol. Diet orders, again, you can add labs, problems that may be billing. And so some of these, like I said, the encounter that would have come from the consultation you have with the patient. But again, you can also have the appointments. So it will show that, okay, patient is a no-show, whether they have checked in and waiting to be seen, or if one of the things is if you have a patient, for example, is supposed to show up, but they have not yet, it's within their window. So let's say today is the 19th. Of course, it's very late here. So let me go here to 2 a.m. 2:40. Let's say 2:46. That's when the patient is supposed to show up, and then let's say it should go on until 3:48. So if and then the status is let's say confirmed. We have confirmed that they will be coming. So if we update this, in fact, now you should actually see that they have been confirmed and they are arriving soon. This is because it's within a 1 hour window. When it's within a 1 hour window, we should be able to see that they will be arriving soon. So once that 1 hour window hits, it will change to that. So once they go past that window, that time though, so let's say we move this a little bit to above the we move it to below 239. So if I go 232, and then now it would have changed to a no show risk, meaning the appointment has been passed and it's been flagged potentially that the patient may be a no show because they have already passed the time that they should have the appointment. And then once they are not show, of course the system will automatically change it to a no show. So that's kind of your appointment. And then during the appointment too, then you will also have your queue. Now what happens is if right now the queue is empty, but if your receptionist now checks in the patient and say, okay, patient check in, they click on that, then you will also see that now it's in the queue, it's moved to the queue. So if you look on the queue now, you see that the patient is actually waiting, right? So because they have already been checked in, but they're waiting to be called by the nurse or the doctor in the room. So now you can view, of course, the patient here, and then you call them for consultation. You can move them to a nurse, okay, or you can do you can see the provider in this case, So let's just say we call them to consultation room. Before we do that, if you see here in the consultation, it says waiting again, just like the queue. So if we click on that one, you can see they're still in the waiting state. But since they are in the waiting state, they have not been moved to consultation proper. So we can easily call them to consultation. Now it says it's in consultation. So if we go to consultation, now it says in consultation. If you click on it, the doctor can start what we call encounter here, and then from that encounter, and our encounters are going to be here. You have different encounters, like every session with the doctor. But you can also you can start that encounter from within consultation also. So if you say start encounter, then you can go ahead and create the SOAP notes. Again, that is just the subject, object, subjective, objective, and assessment and plan. Of course, your doctors know what that means. So you can go ahead and either apply some templates. For example, if there are a few templates here, so you can apply, or if you and then you can start filling those, or you can just go, um, or you can just create your own. So if you don't like these templates, there's only a few of them, but you can create your own, documentation. And then you can also see any encounters that has they have an encounter that was open, so you can click on that one, and then it will actually open that encounter. Or if you want to add a new encounter charges, you can also add new one. So for example, in this case, if we want to add, remember that's the bundle services, you can add them here. So let's say dental package here, because within just like we have the bundles in the inventory management, we also can have one in here as well. So if you look down here, you'll see it has where is it, service bundles here. So we have created some service bundles, so we can add them from here. So again, you can either do that, or you can even add your medications that you want. So if you want, let's say I just want to check for amoxicillin, so I just write AM, so it will show me all the different that has MAM here. So if I click on that, it can start adding, and I can also add the bundle. So let's save the bundle. I can add more. So yeah, so you can add all your medications here. You can also add your encounter charges here. You can also add any medications that you are going to be dealing with, so here, and any labs that you want. So once the doctor is done with everything, they can, again, this will show the previous vitals, as well as you can add more vitals here. Any diagnosis you can add here. Again, this is primary or secondary or comorbidity, and then the ICD-9 code for that is any description. You can, once you have all your stuff, the doctor, again, they don't have to go to encounters. They can just simply complete visit here. And then they can also do follow up if they want. So in this case, follow up in 1 week, or maybe in 2 weeks, or in a month, and then follow up reason. You can give your the check labs, for example. So, and then you can close that one. Once you close the encounter, got a permission issue here. But once you are done, you can close, and of course you can save your notes, and once you save them, you have them here. But you can also go ahead and close that. So if you done with again, you are done with the encounter. If you come on the encounter, you will see that it is open here. Hang on, where is that encounter 24? Oh, sorry, it's build. Hang on here, sorry. Yeah, oh yeah. So it's already built, right? So it is this encounter here. So we have seen it is built to, so it's open. Yeah, so it's still open. So you can finalize, you can come here, the doctor can just come here again. You can add more stuff here, but you can look at all the complaints here and the labs and all that stuff. So you can then finalize the encounter. If you finalize the encounter, it will lock it for now. You will not be able to add any more notes to it. So then the doctor, then once that happens, it will do some kick off some billing. So if you go back to payment portal, your cashier will have gotten that information. So if they come on the payment portal like around here, so they should be able to go on the billing sessions and then see any bill, for example this one here, and they'll see the encounter stuff here as well. So they can also look at the claims here and then see the inventory, this here. So because they need to collect the money, so they can easily copy this inventory. Invoice, I meant to say. So if you look at the invoice, this is the invoice. So invoice is, you can view the invoice, and this is, for example, that is going to be sent to Alpha Bali, and this is the amount. So you can print out this invoice and send it to them, right, for them for payment. Now you can also, of course, submit a claim to insurance, or you can record any adjudications. For example, if the insurance came back and say, well, we're not paying the whole 6,400, and you can, they say they only wanted to pay 4,400, you can confirm that, and then the rest will be billed to the patient. So in this case, let's just say we copy that invoice. So if you look at the top right here, you'll see invoice. So if you click on that invoice, you can put that invoice number here and then search. Then it will pull that invoice from the encounter with all the billing and everything. So it will then either you can self-pay, because this money is going to go to the cashier, and then you can do self-pay, or you can pay, or you can do insurance. So you can also see from the insurance, it already pulled the insurance policy number here, and you can also see if let's say per the insurance they need to pay like maybe $500. That's what the insurance say co-pay is. So they can put that here. So now, and then it can be loaded. So once it's loaded on the card, you see that it's 6,400. That the information, this information came from the encounter that they had with the doctor, and whatever was there added as a service, now it's pulled into here. So obviously you could have just simply get all of this information from here, but because it's convenient, you just get it from the invoice, so you can pull it from there. So again, you can come through and then do insurance. Again, if they have to, now it says they need to pay 500. You can see the system automatically remove the 500, and then they have out of the 6,400, they only have to pay the insurance is going to pay 5,900. So now the cashier can go ahead and collect that 500 now. So once they collect that 500, then so again 500 has been collected. So they collect that 500. Now automatically you see the receipt is being given, and then they can print the receipt. Once that receipt is done, you can go back to the claims. If you look, you can see now it says this is billed. If you click on the encounter, it's billed. So if you look, you will see that that's already billed. So if I go back to invoice and click on the invoice again, now you see that if I look here, hang on. So that's the draft invoice. Where is the one that was completed? Yeah, so yeah, so this is the one. So this is the one that was invoiced already because it went through the cashier. It says paid. But if you look, they paid 500. So if you look, sorry, that's the wrong one. I know, sorry, I was testing here, so I had so many of them. I can't remember which one I'm working on. This is 519. I think it's this one. Yeah, so let's look at that one. So yeah, so this one here. So again, what I was trying to explain is you can um, submit the claim to insurance, but let's just say insurance came back and say, well, we are not going to pay that. We are only going to pay just 4,400. If you click on that one, now it says that the insurance approved 4,400. The patient owe 2,000. So if we go and look at this, now this is the amount that is going to be. That's a partial payment, right? So and the patient is going to pay the remaining balance for that one. But they need to record. So again, insurance payment. Let's say insurance went ahead and paid 4,400 that they talked about through bank transfer. So if we go back and see the invoice again, so now we'll see that the balance due is 2,000. That is, due for for the patient to pay back. Yeah. So basically, it's a lot of stuff here, but I just wanted to show you that in fact this thing does have a potential for you guys. Not sure, but I know you said you guys already have like um, you already have like an EMR, but this is also an option for you guys. So, but again, there's apart from the encounter stuff, of course, you have orders. You can see all the orders. The orders that went to lab, orders that went to pharmacy, orders that went to radiology, all here. So you can look at all of those things. And again, the vital signs, you can look at the different vital signs from the patients, or you can look it from their chart. Prescriptions, similar thing. Lab orders, again, similar thing. You can click on here, for example, you can see that sample has been collected, sample is collected, it's ordered, this one is ordered, it's in progress, and then the status is start urgent, and then yeah, you can enter results here. Once the results come back, we see again different things start processing. Yeah, so and then you can also look at chart notes. For example, you can look at let's say you had a surgical console, and here here is that encounter. That's that we that subjective, that soap format that we entered is here. So you can also look at again that bundles that I was talking about. Of course, we have a financial overview here, as well as this month, last month, or total that was billed, stuff like that. The cashier, of course, can collect, payment. This is not collecting payment, but this is going to be, yeah, you can record payment here also in this module. If you don't want to use the payment portal, you can also record payments as here as well. So again, you can see all the different providers here. So you can look at it, grid view. You can click on provider and also the information here, right? This is pull from the employee table, employee page. So you can also look at it from a table view, or the providers. You can search for them by name. So all of that. You can look at radiology, for example. Again, similar thing here. You can look at what is ordered, cancel, or do new, add new imaging order. So again, that has different things here. You can look at different pieces. You can select your patients and stuff like that to create the order. If you're dealing with a hospital bed, so you can also do that similar thing. So you can add a new bed and say the location, the floor, where the ward it is in, and then the ward type. You can add all of that here. So if you click on a bed, you can see whether the bed is occupied. In this case, it's in, you can say whether it's available discharge or maintenance. So like this bed is occupied already with the patient. So you can look at all of that information from here. So this is in maintenance. And then you can look at admissions if you're dealing with the hospital. Again, if you are, you can click on a patient and then you can see, their admission stuff, admitted, their doctor, what's their diagnosis, any vitals they may have. So you can open the chart, the patient's chart from here. So if you click on it, it will bring you back to the patient's chart. So you can go back to that place, and then you can do like discharge, or you could plan discharge, or you can discharge the patient, or you can transfer them to another bed. So that feature is coming soon. Like I said, this is still a work in progress. So it should be probably close to being done in the next few weeks here, but we are still working on this. So again, here this is an empty bed. You can admit a patient on this bed. So again, stuff like that. So yeah, that's the admission insurance stuff. You can see any new claims. You can add them here. Any settings, you can set the MRNs, for example. You can either use whatever prefix you want. You can use 5 or 6 digits. You can use the year, for example. So you can do the same thing with appointments and RX and orders, and you can save the defaults as well. So you can also have clinical templates. For example, here are your standard consultation stuff that we have seen in the SOAP. So again, you can set these are 3 different templates here, but you can create new templates for your own use as well internally. Where you can have those templates, and then you can always import it so that it can be quicker for the doctors to use as they do documentation. You can also do any referral. So if you're gonna do a referral, you can do a new referral, for example, and then that referral is here. You can fill in the patient's name, the routine that is it a routine or urgent, and let's say they are going to be urgently going to emergency room. You are referring them. So this can be internal or external, and then the treatment they need, stuff like that. So that can be created. And you can have different reports here. The reports are still work in progress. So, but again, there's few ones here. So that's kind of like high level view of the healthcare module. The pharmacy is similar case. So you have the dashboard, and then the RX. In fact, one of the things is if you send let's say you make an order from the health care, so if you have an order, if you send the order automatically will appear in the pharmacy if you have both modules. Obviously, if you don't have the pharmacy module, the orders wouldn't be, so you have to manually send it to the pharmacy. But if you have both modules, then you can send the order from the healthcare module into the pharmacy, and then it will show up here, and then you can see different states, whether this is received, but we have not done anything with it. And then this one we are verifying it, and this one is ready, and then this one is dispensed already. So you can see different things here, and order whether that's put on hold or it's rejected, all of those that things. So you can see more details here as well. So you can fill in more stuff here. So for example, this prescription can be edited with the name of the um, doctor, for example, and then the patient. Um, yeah, so you can see any of the pharmacists, say, uh, for example, and any stuff you can update that information. So again, the patient information. If the patients are shared, meaning if you have both modules, the hospital, the clinic, and the pharmacy, you don't have to create patients for both of them. They can be shared across the two. However, if you don't want, you can create one for each other, because here you can register a new patient just like you can do with the healthcare. But yeah, so but if you only have one of the modules, then you will just need to create a patient in that particular module. Again, your drugs, here are your list of drugs. These are the ones that are pulling from the inventory management. Remember, we talked about inventory management. These are getting pulled from that. So you can see how many of them are low stock that needs to be replenished. Maybe we need to order them very soon. You can click on it and see the details. Anything that's expiring, anything that's a controlled substance, that will be marked as that. If you mark something as controlled, then that should show up here as well as that. So again, this is what that is. Again, any supplies, so you can create new suppliers, sorry, that are going to be supplying you for those drugs. Um, and here you have the pharmacy billing, again similar to the other one. So it will show up the sample, the collection from the medications and all that stuff. And then any regulatory stuff that needs to be flagged, reporting, and yeah. So and again, settings similar to what we have in the patient care. Yeah, again, these are all work in progress. I just wanted to do a quick one on this one, just to show you what is currently being worked on. Not completed yet, but it's a work in progress. But should be pretty much close to getting production scale or production grade in the next few weeks here. Okay, thank you very much.